Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th, with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.
Welcome to St. Louis on the Air. I'm Sarah Fensky. Have you ever called 911? No? Well, what about 211? In many states, 211 is a shortcut to the kind of help that's slightly less urgent, but no less important. Dialing 211 cuts through what often feels like a maze of health and human service agencies. People who call it get referred to the places that will help them the most efficiently. For researchers at Washington University, though, 211 is good for more than just referrals. It's also a valuable source of data. It provides the basis for the university's 211 Counts project, and also a new layer they added earlier this year to examine the impact of the pandemic, and that is called Focus-19. And joining us today to talk about these two related projects and the 211 system is Matt Kruder. He is a professor of public health at Washington University. Matt, welcome to the show.
Happy to be here, Sarah.
So you've been using 211 calls as a source for a while now. What first got you interested in this data set?
Actually, I remember being in a meeting at the Missouri Foundation for Health, and at the time, this was like 13 or 14 years ago, and at the time they were hearing a proposal about bringing this 211 service to the St. Louis region and to Missouri. And I was just so blown away by the idea that this single stop that was as easy as dialing 3 digits could be available as a resource to people in our community. And we've been partnering with 211s locally and across the U.S. ever since then. And it's really a remarkable resource.
So what do you do with that data once you get your hands on it?
So we currently work with 36 states, and these 211s, they're talking to folks by the thousands in every state every day, and they are recording what people need, what people are asking about. And so we get daily updates from these 36 states, and we are trying to take that information and liberate it, if you will, and make it known to local decision makers and leaders and philanthropies, so that as we allocate resources and decide what community priorities are, we can do so, with some data driving what folks in communities across the U.S. need.
Have you been able to get decision makers to pay attention to the way you've crunched this data?
Well, I'd say the evidence that we have so far is anecdotal, but we have some really interesting and encouraging stories from across the U.S. where legislators have actually used data from this dashboard to justify policies. One example is in Connecticut that will provide support for those who can't pay their water bills, and there was no real local resource to help that. And there are other stories like that from across the U.S. So yes, people are using it, and it is influencing policies and the sort of aid that's available to vulnerable Americans.
So is the number one way that it's useful is in finding the gaps where people are not currently being served, or is it also, oh, hey, we're seeing a real spike in this thing, and yes, we're handling it. We may not be able to handle it much longer.
I think it's all of those things, Sarah. So one of the benefits that you get with a surveillance system that's updated daily is you can see when there are departures from the norm. And this is one of the things that happened in the case of COVID, where literally within days of the World Health Organization declaring a pandemic back on March 11th, we saw increases of almost 500% in requests to 211 for food pantries and for diapers and for toilet paper and things like that. So you definitely can pick up almost immediately signals of where there are spikes in need. And the other piece of this that's so important is that 211 captures these data at a highly local level. So we know what's happening at specific zip codes on specific days, and that's really unique.
I understand that one of the things that you spotted long before it came to the public consciousness was the Flint water crisis. How did that manifest itself in this 211 data?
So it's a great story. So the 211 in Michigan had been receiving calls from concerned citizens in Flint, and so they created within their 211 some categories to capture these concerns. And sure enough, we were able to see, really months before this became a national story, this this growing demand for help with these water-related issues in Flint. I would say, going back even earlier than that, we had one of our colleagues, Dr. Karishma Furtado, who looked at some data from the early stages of the housing mortgage crisis in 2007, 2008, and she found 9 months in advance of the crisis really exploding, these increases in people calling for mortgage assistance and decreases simultaneously in people calling about home improvement needs. So people were sort of divesting in their homes and looking for help paying for the mortgages. So there's no question that these 211s catch very early warning signs, flags, if you will, of pending concern.
Wow, that's so interesting. This seems like one of these data sources that we should be looking at so much more closely instead of, say, the stock market. We're always judging how the economy is doing based on whether these stocks are up. Yet this seems like it's much more connected to how real people live.
Well, I think it is the closest thing that we have in the U.S. to a surveillance system of the day-to-day needs of many Americans, certainly of vulnerable Americans.
We're talking today to Matthew Kruder. He's a professor of public health at Washington University, and he's talking to us about the two projects they have that use this 211 data. The first one is 211 Counts, and this has been going on for years now, examining this surveillance system. And I know, Matt, as you mentioned, since COVID-19, you have expanded to this new layer. You call this Focus-19. How is this different than just looking at the needs that are happening in St. Louis in real time?
So we were seeing, as I mentioned before, we were seeing these dramatic increases in a lot of social needs in the early stages of the pandemic. And we felt really, I think, a responsibility to share this information in a timely way with local leaders and communities so that they could understand not just what the magnitude of this impact was, but trying to maybe get behind just the numbers and the need to try to explain some of it. So in addition to simply reporting how much needs for rent or utilities or food have increased, looking at how those are associated with local policies, for example, around eviction protection or around not disconnecting utility services. Also to other things like unemployment claims or labor statistics, to see that these things aren't happening by coincidence within communities. There are real drivers to this that that communities can address.
And is the goal then to make that data set something that will make sense even to people who don't have your level of training, that we can look at this and see how these impacts are playing out?
Well, we hope to do that. So we've created through this Focus-19 initiative now over 70 reports. They're very short. They're about a paragraph each, and they include kind of one or a few key data graphics, and they're meant to be very accessible. This is not a product for other scientists. It's really a product for lay people and community leaders.
I understand in just the last week, you and others at the Brown School's Health Communication Research Laboratory, that's quite a mouthful of a name right there, you spun off a St. Louis-centric version of these reports. What are you seeing in terms of some of the local trends that stand out to you on this?
So I would say we're very early on in this endeavor. We have generated now, I believe, 3 St. Louis-specific reports. So we're really excited about making this local. But as an example, this is maybe beyond just the St. Louis area, but Missouri in general, we looked at the relationship between unemployment claims and rent assistance requests. And in fact, you find exactly what you would expect to find, that places where there are more new unemployment claims, there are also more rent assistance requests that that 211s are receiving. We've also looked at electric bill payment requests to 211s, and those have really skyrocketed since Ameren suspended its disconnection prevention notice. So another link between policies and the needs of individuals. And we're also looking at transportation. It's interesting, there's a lot of demand for transportation, people who need help getting to doctor's offices or getting to work, and they just can't afford it. Those really dropped off in the early days of COVID. People didn't want to be around crowds. They're now increasing again, but the way they're increasing is different. Those who are in more densely urban areas are really looking for help with public transportation passes and vouchers and things like that, while people in outlying areas tend to have cars, but they can't pay to operate their cars. They need repairs or they need fuel, and so they need assistance just to carry out their daily activities.
Wow, Matt, this is just a lot of sobering stuff, and I imagine I'm just feeling a small fraction of what you feel as you're looking at the volume of reports. I'm almost afraid to ask you this, but overall, how bad is America doing right now from these 36 states?
If you measure it based upon the demand or the needs, we're twice as high as we were over the same period a year prior, and even in 2020 prior to the pandemic. And that's down. There were times when it was 300% higher. Just to put that in some perspective, it's not just that you're getting twice as many calls as you used to. Every one of those calls is somebody who needs help. They're getting referred to agencies that do not have an endless supply of resources and assistance. There's just far more demand for help right now than there actually is in most communities, and we're going to have to be a lot smarter and more efficient in how we allocate this. And that's where I think information like this, as sad as it is to see, can be helpful and can help hopefully direct resources in an optimal way.
I understand United Way is a key partner in all of this. In the St. Louis region, they manage all of this 211 call activity. Have they been interested in all the data that you're gathering?
Oh, goodness, yes. And, I probably haven't said enough about United Way of Greater St. Louis. I mean, we're not here today. We're not doing any of these projects without their partnership and commitment over, well over a decade. And actually, 211s across the country are overwhelmingly run by or through or funded by United Ways. So United Ways and 211s are really, they're the backbone of all of this. We just are fortunate to be able to partner with them and try to bring about community improvement with their help.
Okay. Well, you've been looking at 211 counts for a while now. You have this new Focus-19. This sounds like a great project. Do you see any future expansions? Are you busy enough with what you've got on your plate right now?
Well, actually, there are still about a dozen states out there that are not yet participating in this system, and we expect that in time they will come along. And then, to have a national dashboard that allows leaders at every level of government and in service organizations and philanthropies to be able to get really reliable, up-to-the-moment data about what's happening in their communities, I think is going to be a tremendous resource. And I think that 211s and United Ways are going to, they're just positioned so well to be part of a new kind of data-driven approach to community improvement and social services in the years ahead.
Well, you've certainly made a very persuasive case here. I find myself thinking, this is the greatest system. Why don't these other states get on board with this? I also want to say, for people who are interested in this data, you mentioned that this is meant to make sense to the layman. Where should people go if they want to see what you're describing so well here?
If you want to see any of the state dashboards, including the Missouri dashboard, you just go to 211 counts and click on Missouri. If you want to see the Focus-19 reports, if you Google Focus-19, Washington University, it should take you right there.
Well, that's great. And I'd recommend people check this out. If you didn't catch all of that from Matt, we'll make sure we have that on our website. That's stlpublicradio.org, and a link that'll take you right there. So Matt Kruder of Washington University, I want to thank you so much for joining us today.
Sarah, thanks for having me.
This is St. Louis on the Air on St. Louis Public Radio. That's 90.7 KWMU.
Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th, with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.